the way I want to talk about it is sort of relating to a lot of the other discussions is around access to medicines. Now, why is this important to Oxfam? Well, 2 billion people still lack regular access to affordable medicines today, and there certainly are a lot of reasons as to why this occurs. And in our perspective, one of the important reasons is due to cost. And the important statistic to think about is in developing countries today, 60% of, on average, 60% of healthcare budgets are spent on medicines. This creates very difficult choices for healthcare systems between medicines, between building a healthcare system, between training healthcare workers, engaging in prevention. And often many medicines that are needed in healthcare systems cannot be provided, and they fall upon people to pay for out of pocket. So in a lot of our work and a lot of research that's done by the World Health Organization and other organizations, it's shown that one of the highest costs for poor people in developing countries is the out-of-pocket costs for medicines as well as food. So it's very important to focus upon what the real consequences are in developing countries and why this is an important issue for advocacy groups. Now, in terms of talking about why we're concerned with access to medicines in relation to the pharmaceutical industry, well, the starting point and the ending point is that it's important for developing countries to have access to affordable generic medicines, because prior to the introduction of the World Trade Organization and even afterwards, this really has been the key basis for developing countries to provide health care. And it's certainly admirable that companies like Merck and I think a lot of other countries are not patenting medicines in least developed countries. But that's actually part of the World Trade Organization rules. Actually, they don't have to until 2016. The real concern isn't so much in least developed countries that are recipients of medicines, because the reality is that they can't produce medicines, but it's in the producing countries that export them to developing countries. And in particular, when we think about this, we think about India, which produces 70% of the world's generic medicines and 80% of the world's antiretroviral medicines. So the concern has been for civil society groups on how to ensure that generic medicines that have been provided for years from India and from sort of other centers of generic production can continue to keep healthcare costs down and to allow healthcare systems to expand and to ensure that we achieve the right to health.